Hello, welcome to my YouTube channel. Today I would like to discuss yellow fever in details. What is yellow fever? How is it transmitted? Which are the risk groups? Which are the risk areas? How can we manage yellow fever? And what is the role of WHO in yellow fever? Yellow fever is a mosquito-borne viral disease. Primarily, it is transmitted by day-biting mosquitoes. 27 African countries and 13 Latin American countries are classified as high risk for yellow fever outbreaks. The potential for international spread to unaffected regions remains a global health security concern. A safe, affordable vaccine provides lifelong protection with a single dose. So, um, Yellow fever is an epidemic prone, vaccine preventable disease, and it is caused by transmission. We said day mosquitoes, especially Aedes species, Hymomagus species, and the Sabithes species mosquitoes. These mosquitoes are breed in domestic, forest, and semi-domestic environments. Due to its global high impact and potential for international spread, yellow fever poses a significant threat to global health security. Which are the symptoms of yellow fever? The initial symptoms of yellow fever are headache, general body aches, nausea, vomiting, and weakness. These symptoms typically they disappear within 3 to 4 days. uh, we are going to have according to the data which we have, around 15% of people infected with yellow fever will have the severe infection. Symptoms are like recurrence of high fever. We're going to have jaundice, vomiting, bleeding, mostly of the mouth, nose, eyes, and stomach, organ failure, and shock. About 50% of patients during this phase die within 7 to 10 days. The incubation period for yellow fever is 3 to 6 days. Treatment. How do we treat yellow fever? There is no specific antiviral treatment. Clinical care remains mostly supportive with the 2025 clinical management guidelines providing a protocolized approach. The two antivirals that can be given, we have the monoclonal antibodies and the sofosbuvir, and are recommended exclusive in research settings. Supportive care, we are going to have rest and hydration, management of liver and kidney failure and fever, and antibiotics for secondary bacterial infections. Patients may be managed at home, hospitalized, or referred for emergency care depending on severity. Jaundice is an indication of severe disease, justifying hospitalization, often in an intensive care unit. So, moving on to next, diagnosis. How do we diagnose yellow fever? Diagnosis is a bit challenging, especially early on when clinical manifestations are non-specific. Severe cases may resemble malaria, viral hepatitis, other hemorrhagic fevers such as dengue, and poisoning. Diagnosis is carried out in the early stages. We are going to have reverse transcriptase polymerase chain reaction, that is the RT-PCR testing of blood. And in the later stage, we have antibody detection, that is through ELISA or plague reduction neutralization test. Okay, prevention. How do we prevent yellow fever? Vaccination is the most effective preventive measure. A single dose provides lifelong immunity, and no booster is needed. Immunity develops in for 80 to 100% of people within 10 days, and in over we are going to have 99% within 30 days. Vaccination is not recommended for infants under 9 months, pregnant women, people with severe egg allergies, individuals with severe immunodeficiency or thymus disorders. Above 60 years, careful consideration should be given to the vaccination risk benefit ratio. Vector control. Vector control, how do we do vector control? Vector control is carried out by eliminating mosquito breeding sites, using larvicides in water containers, and wearing protective clothing and using repellents. Insecticide treated bed nets are less effective as the mosquitoes transmitting yellow fever bite during the daytime. Okay, what is the epidemic preparedness, surveillance, and response? We are going to have rapid detection and laboratory confirmation, as well as emergency vaccination are critical to control outbreaks. In outbreaks, the WHO estimates that actual cases may be 10 to 50 to 250 times higher than reported. High risk countries should remain at least one national laboratory for yellow fever testing. Okay, what is the WHO response in cases of yellow fever? The Eliminate Yellow Fever Epidemic Strategy is a comprehensive and long-term strategy, which is the WHO has built on lessons learned from urban outbreaks, which we had in, for example, Angola and the Democratic Republic of Congo, that is the DRC. And this response aims to end yellow fever epidemics by the end of 2026. This strategy is steered by we have the UNICEF, WHO, the Gavi. With the WHO hosting global secretariat of the partnership. What strategies are we talking about here? We have mass vaccination campaigns in high risk countries to prevent outbreaks with routine children immunization and catch up interventions to sustain the gains. Strengthening urban preparedness and protecting high risk workers. Then lastly, we have early case detection and response for rapid outbreak containment. With this, we can say yellow fever, in as much as it is posing a health threat globally. It is an infection which the WHO is trying to fight, and it is our responsibility to ensure, like for example, in the high risk areas, we are going to have prevention of the outbreak so that we can minimize severity in cases where we are going to have outbreak of the yellow fever. With that, that's all I had for today, and thank you for listening, and don't forget to like, subscribe, and share the video. Thank you.